Hi everyone, I'm Dr. Suarez, and I wanted today to talk to you about my journey with breast cancer. This is a very difficult topic for me. It's fairly new this year, and so I just wanted to educate you and all the stuff that I've learned to really help and hopefully impact someone's life. So I'm not sure if you're aware, but 1 in 8 women are diagnosed with breast cancer every year. Just this year alone, we had greater than 300,000 individuals diagnosed with breast cancer. So I think it's really important that we take a step back and try to figure out, what does this mean? And how do we protect ourselves and our loved ones? So I just wanted to tell you a little bit about my story. So from the age of 18, I have always had fibrocystic breasts. I had my first biopsy done when I was 18 years old and was told it was normal and not to worry about it. You know, to limit your caffeine, to limit your diet, and so I did, and I continued to live my life healthy and happy. Over the last, I would say, probably the last 5 to 7 years, I continued to have more fibroadenomas, and I've had a few biopsies in the past that were all okay. And so I've done religiously my mammogram every single year. And I think it's really important for women to know that sometimes it's not only a mammogram we need. If you have dense breasts like I do, it's really hard to be able to see on a mammogram. So you'll notice that you'll be asked to do an ultrasound also, that they can see a little bit better for dense breasts. So it's really important that whichever modality they ask you to do, that you take that opportunity to make sure you follow through and look at all different modalities. So again, just because we do a mammogram and ultrasound does not take away the opportunity to do a self-breast exam every single month. I can't begin to tell you how important this is. So I found my tumor with a self-exam. It's really interesting. I wasn't even trying to find something. It happened by accident, and I always say it was by the grace of God that I found this early. But interesting enough, many times when I'm laying in bed, we kind of lay like this and we cuddle in our bed, and it was all the way lateral of my breast. So really on the tail of our breast tissue, which is really odd, right? So I actually, when I first found it, it felt like a little tiny pea size. It was very close to underneath my axilla and my armpit, so I thought, oh, you know, it's probably a lymph node. I started examining myself, making sure there's no other enlarged lymph nodes, and figuring that out, and I realized, no, it's part of my breast tissue. It literally felt and like a little tiny pea size, and I was actually able to almost roll it in my fingers. It was that superficial, and it did not hurt. And I think most women do not realize that breast cancer typically does not hurt. It typically just shows up. Fibroadenomas and cysts are usually painful, and they're mostly painful during our period months. So when you start to find something that's non-painful, it should definitely be a red flag for you. So here I was playing with this little thing, and after about 2 weeks, I thought to myself, I really should get this checked out and not really postpone this, right? I will say though, I still didn't think it was anything, right? I've gone through many biopsies, and I thought, you know what, I'm just gonna go through this process, check it off, and do it. So I got in touch with a surgeon that I was told they would be able to do the biopsy right in the office, and I thought, perfect, let's just go in. So I went in and spoke with her, and she took a look at where it was, and she thought because of the position was it and the size of it, it would be very difficult to do an in-office procedure. So we had a couple options we talked about, right? She thought my risk was really low, and we said, okay, do we wait 6 months and just watch it, was option number 1. Option number 2 was do an MRI with contrast, take a look at it, follow it, and option number 3 was a biopsy. So she was a little bit worried about the needle and you know, the painful of the procedure, and I kind of laughed and said, don't worry, I stick needles in my face all day. I'm okay with needles. I was gonna wait, but honestly, because I'm always so busy, I didn't want that to be in the last part of my mind. I didn't want to forget and follow up and make sure that this wasn't something that was bad, that was growing for 6 months. I definitely didn't want to do an MRI, because I thought if I do an MRI, I'm still going to have to do a biopsy. So I said, well, let's just do the biopsy, cross it off my mind. It's not my first biopsy, and we'll just get it done. So I went in and got my biopsy done. It wasn't the best procedure. It does hurt a little bit, but you know, again, that's all relative in finding out if you're gonna be okay or not okay. And honestly, I still would say 99% I didn't even think about it. I honestly didn't even think it was gonna be breast cancer. I actually told my surgeon, joking around, I'm not coming back in for my follow-up, just give me a call, I'm gonna be fine. You know, I'm going back to work and going on with my life. And I remember, like it was yesterday, it was a Friday evening, I had just came out of work and I was working, I think I left around 5:30 out of work, and I was coming home and I was actually going to go pick up some food for my kids. And she calls me and she says, you know, are you driving? And all of a sudden I felt this sinking feeling. Why would you ask me if I'm driving unless it's bad news? And I said, there's no way it's bad news. I just can't even believe that. And she goes, yes. She goes, we're very, very surprised. She goes, but it is breast cancer and we need to figure out your next steps. So what do you do with a diagnosis like that? I will say this is probably going to be the hardest clip for me to go through. It's very personal, I think, how we all handle this diagnosis and how we go through it. I will say though, the shock was there. I felt like my life just came to a halt. I had to figure it out. And I knew that I wanted to stay positive. I knew that I had to be strong. And I knew that my faith would get me through this. I happened to be going away that Saturday morning, away for a weekend trip. But I couldn't just go away and not process this. So the first thing I did is I called my sister and I told her on my way home. And I called my best friends. And it's interesting how I had to be strong to tell them. They broke down on the phone crying, and I said, you can't cry because you're gonna have to help me get through this. And it was interesting that I think it took me over a month before I had a tear. I didn't cry the day I was diagnosed. I think the first time I cried is when I had to tell my children, because I knew I had to be strong. So it was interesting. I came home, I told most of my family, I told my boyfriend, and then I paused for a moment. I went away, I reflected that weekend and tried to come up with a plan. And I worked it out systematically. I said, okay, this is probably the physician in me, but I said, these are all the things I have to get done. I need to figure out everything I need to know about breast cancer, what it is, how do we treat it, and you know, even as physicians, we don't know every single thing. We have to go back and research it, just like everyone else researches. And so I really wanted all that information to make what's the best decision for me and my family. And going through that, it was very difficult. I did a couple things that I didn't know I was going to do, and I processed. I literally started writing and taking a video journal for myself. Every day I posted a 30-second or minute video about going through what was on my mind. What questions did I have? What was I so afraid of? What was going to be my treatment plan? How was I going to make those decisions? And what I was really shocked about is how much I wavered. I wavered back and forth constantly. And even though I was so sure at one point, I changed again. And you have that right to change. It is not black and white, it is gray. And you need to do what's best for you and how to go through that transition. So I knew that I had to stay positive. I knew how important this was for me to have a good mindset to go in there. I knew I had to pray, and I knew I had to be faithful. So I remember the hardest part for me was, how was I gonna tell my children? I didn't want to tell them until I had a plan. That I knew what type of surgery I was gonna have. I knew what was gonna be my long-term goal. Obviously, I'm not gonna know about chemotherapy and radiation, but I needed to have a game plan to tell my children, because I knew they would have those questions. So I decided to take them away for the weekend before my surgery. And we went to Sarasota, and I knew I had to tell them. And I knew it was gonna be hard. I think the hardest part is knowing that I'm a single mom and I wouldn't have anybody else here. That's okay. So I waited till we were all in our hotel room, and I told the babies, I have something to tell you.
But I told them the first thing I want you to know is that I'm going to be okay. And I'm going to be around. So